So I'm Akhila Mallipedhi. I'm one of the consultant diabetologists with obviously an interest in diabetes, endocrinology, but also weight management. In addition to these specialties, I've also been trained in general medicine, which gives me the element to look at the broader aspect of the medical and general health. So I chose to specialize in diabetes and weight management because these conditions sit at the intersection between science, long-term management, and lifestyle. While both of these conditions are incredibly complex, they can still be optimized and managed very well with the right amount of treatment and support. I find it incredibly rewarding to help people make long-term sustainable changes that will help their long-term care and well-being. The initial assessment consists of a holistic history taking exercise, which would include any coexisting medical conditions, the trajectory of weight or diabetes management, any coexisting medications, psychological health, mental health, social history, and many other factors that may be influencing on their conditions. We then formulate an individualized care plan assessing their needs and requirements, which mainly will include lifestyle measures and sometimes pharmacotherapy or weight loss medications or diabetes medications as required. What is also important is to ensure long-term monitoring and follow-up in order to make sure that these conditions are continued to be managed in an optimal manner. Weight loss medications have come at a right time where we are experiencing obesity as a global pandemic. They are only a small part of the weight management program. No part of the program is a miracle. It comes as a full package, and weight loss medications are a part of it. They have been extremely helpful in helping people with complex medical conditions who are suffering as a result of their weight, in leading them on to the right path or making them more suitable to receive further treatments or interventions. So yes, when used in combination with the wider lifestyle and holistic aspects, they can be a very, very powerful engine to help people with weight management. It is an ever-growing field. I was at a conference last week, and there are many, many more coming into the market. And I always hesitate from saying what is the best medication. I think we have to individualize according to the person's needs. The medications alone don't do the job. There's a lot of other support that is required along with the medication. Nutrition, for example, is such a key element in addition to weight management medications, because it is very likely that the person who takes the medication due to suppression of appetite might also lack nutrition and would be at risk of other medical conditions. So yes, there are excellent treatments to help in the weight management journey, and it depends on the individual person's needs which medication we go on to. The weight loss clinic here at Santa Maria is again a multidisciplinary and holistic management clinic. So it starts off with a detailed assessment encompassing medical history, psychological, mental health history, looking at sleep, hydration status, coexisting medical conditions, coexisting medications, and so on. It then involves a holistic, individualized care plan formulation, and most of the times might involve pharmacotherapy, which would be the newer medications that are being used for weight loss. We also strongly recommend follow-up, monitoring and follow-up, as ensuring that support and encouragement is in place is key to long-term weight sustenance. We also do regular reviews while people are on medications to make sure that they're being taken in a safe and optimal manner and people are not experiencing any major adverse reactions from the medications if they are on them. The team are fantastic. I think all of us are here with the common goal to deliver high quality care to people who come here. We work together really well. There is also an option to see multidisciplinary team members here and referral to other specialities, which makes it very rewarding for people who are coming here and also for us clinicians, because we know help is at hand straight away. We know for a fact that obesity is a complex condition that is associated with multiple contributing factors like genetics, hormonal dysregulation, biological factors, psychosocial factors, and environmental factors. It is anything but a behavioral condition. Nobody chooses to be in the overweight or obese category. That is the biggest myth and judgment that is out there. And people like us who are specialists in the area know that it is not a lifestyle choice, it is not a behavioral disease. Therefore, it's very, very important to address people in this situation in a non-judgmental manner and make sure that it is looked upon with equal respect as any other medical condition. Obesity is very closely associated with other what we call as metabolic conditions such as type 2 diabetes, hypertension, high cholesterol levels, polycystic ovaries, sleep apnea, and many other conditions. However, not everyone who is in the overweight or obese category has type 2 diabetes or vice versa. It is very important to therefore look at it as a metabolic condition and treat it in a holistic manner. Yes, when there are significant reductions in weight, there can be significant improvement in glucose levels, and sometimes even remission can be achieved. And this is well evidenced in clinical trials and studies. Type 1 diabetes is what we call as autoimmune diabetes, and it is usually due to insulin deficiency, which is a lack of insulin production by the pancreas in our body. Everyone with a diagnosis of type 1 diabetes will go on to require insulin treatment, either in the form of injections or through an insulin pump. Type 2 diabetes, however, is a metabolic condition which is mostly associated with insulin resistance, although insulin deficiency can be a small element in type 2 diabetes too. And usually the treatments for type 2 diabetes would involve oral therapies prior to going on to require injectable therapies if needed in the longer term. Poorly managed diabetes can cause a lot of unseen and seen damage to the body. So there are different categories of complications from diabetes, most of which are only noticed in the later stages. So it's very important to manage diabetes aggressively from the start. So there are microvascular complications, which would be damage to the eyes, kidneys, and nerves caused as retinopathy, nephropathy, and neuropathy. And they can also be at a higher risk of developing cardiac complications such as heart attacks or even strokes due to macrovascular damage. I think the first thing is to be non-judgmental, to understand that it is not a condition that people have chosen to develop. And I think it is also being practical about the advice given, in the sense of being realistic and something that people can follow for a longer period of time and incorporate into their daily lives. So it is practical, evidence-based, realistic advice in a non-judgmental manner. I think the slimming clubs and diets have been practiced for many people over many years, but we know that in most people, there are often short-term results that are seen, and it is more difficult to sustain the weight loss longer term. So many people do experience weight loss through slimming clubs or diets, often to go on to regain either partial or most of the weight that is lost. What a weight management clinic tries to do is look at the long-term outcomes and ensure a holistic wraparound care being provided, if necessary, in addition to weight loss medications that would prevent this weight regain and ensure adequate nutrition and quality of life in the longer term. I think the earlier is better at all times to seek advice and intervention. So what I would say is, if people feel their diabetes or weight is affecting their physical health or mental well-being, there is no right time. I think the earlier, the better. We know from clinical trials that early interventions often leads to longer-term benefits rather than coming in later. However, it's never too late as well. So at any point when people feel that their life or health is being affected, they should seek some help. I think Santa Maria is a fantastic option to receive high quality care from specialist clinicians who are well versed in their field. I think what they get is the option to see the chosen specialists in a timely manner without having to wait too long. They also get to see their clinician for a longer period of time and therefore are able to get answers to the wider questions that they might not get elsewhere. In addition, it's a fantastic new facility that has been put up in Swansea, which is an excellent asset to the community here. I'm Dr. Akhila Mallipedhi, consultant diabetologist and a specialist in weight management. For any further information or advice, please get in touch with Santa Maria Hospital.